Hello, dear, and welcome to the Life and Care America, your trusted guide to living well in the USA and beyond. Today's topic is as important as it is time-sensitive. We are diving deep into something many people have heard of but few truly understand: the emergency contraception, widely known as the morning after pill, or, for those seeking a clearer nickname, the 72-hour pill. Whether you're tuning in from the bustling streets of New York City, the quiet countryside of Finland, or a dorm room in Tokyo, I want to first ask, where are you in the world right now? And more importantly, what time is it for you at this very moment? Because when it comes to emergency contraception, time is everything. So grab your notepad, or simply listen with care, because this message could one day protect your health, your autonomy, or that of someone you love. What is the morning after pill? The morning after pill, technically referred to as emergency contraception, is a medication designed to prevent pregnancy after unprotected sex or contraceptive failure. That means if you had a condom break, forgot to take your regular birth control pill, or simply weren't protected during intercourse, this is the option that may help prevent an unintended pregnancy. There are two main types of morning after pills available today: levonorgestrel and allopurinol acetate. These pills are not the same as the abortion pill. Emergency contraception does not terminate a pregnancy. It works before pregnancy begins, which is defined medically as the point at which a fertilized egg implants in the uterus. Before we go deeper into our discussion, if you find this information helpful, please consider giving this video a like and perhaps even subscribing to our channel. Your support means the world to us and helps this small healthcare channel grow, enabling us to continue providing valuable insights and knowledge for your daily life and health. Now, let's get into the specifics. The morning after pill primarily works through two key actions. The first one is delaying or preventing ovulation. This is the most crucial and primary mechanism by which the morning after pill effectively prevents pregnancy. Ovulation is the pivotal event in a woman's menstrual cycle, where a mature egg is released from the ovary, making it available for fertilization by sperm. The morning after pill contains synthetic hormones that meticulously interfere with the body's natural hormonal signals. These synthetic hormones work by temporarily disrupting the precise hormonal surge, specifically the luteinizing hormone, LH surge, which is the direct trigger for ovulation. By either delaying this surge or preventing it entirely, the pill ensures that no egg is released from the ovary. If no egg is present in the fallopian tube, then even if sperm are present from unprotected sex, there's nothing for them to fertilize. This effectively breaks the chain of events necessary for conception, significantly reducing the likelihood of pregnancy. The efficacy of this method is profoundly time-sensitive. For levonorgestrel-based pills, they are most effective when taken within 72 hours, 3 days, of unprotected sex, though they can have some effect up to 120 hours. Allopurinol acetate-based pills, ELA, have a slightly longer window of effectiveness, up to 120 hours, 5 days, after unprotected sex. The sooner the pill is taken, the greater its chance of successfully disrupting the ovulation process before it occurs. The second key actions is preventing fertilization. In addition to its primary action of inhibiting ovulation, the morning after pill also possesses a secondary yet significant mechanism: preventing fertilization. While the main goal of emergency contraception is to stop the release of an egg, some formulations of the morning after pill, particularly those containing allopurinol acetate or higher doses of levonorgestrel, can also make fertilization less likely. This is particularly relevant if ovulation has already occurred or is imminent when the pill is taken. These pills can impact the reproductive environment in several ways, They may alter the cervical mucus, making it thicker and more viscous. This increased thickness creates a formidable barrier, making it significantly more difficult for sperm to swim through the cervix and travel up into the uterus and fallopian tubes to reach an egg. Furthermore, the hormones in the pill can potentially interfere with the movement or function of both sperm and the egg within the fallopian tubes. This interference can create an environment that is less conducive to the successful meeting and fusion of the sperm and egg, thus diminishing the chances of fertilization. While this mechanism may not be as robust or consistently understood as the inhibition of ovulation, it serves as a crucial additional layer of protection. This multifaceted approach significantly enhances the overall effectiveness of the morning-after pill in preventing an unintended pregnancy, especially when every moment counts and the pill is taken as promptly as possible after unprotected sexual intercourse. It is absolutely vital for all women to grasp a critical truth. The morning-after pill is not 100% effective in preventing pregnancy. While it stands as an invaluable tool for emergency contraception, its success hinges critically on timing. The morning-after pill functions optimally when administered as soon as humanly possible after unprotected sex, ideally within the first few hours. Every hour that passes significantly diminishes its effectiveness. Waiting until the 11th hour, such as the 72-hour mark for levonorgestrel-based pills or even up to 120 hours for ulipristal acetate, substantially reduces its ability to prevent pregnancy. One of the primary reasons for potential failure is critical to understand. If ovulation has already occurred, meaning the woman's ovary has already released an egg, and fertilization has already taken place, the morning-after pill will be rendered ineffective. It is not an abortifacient. It does not terminate an existing pregnancy, nor does it interfere with an already fertilized egg that has implanted in the uterus. Its mechanism of action is preventative, not interventive after conception. Therefore, immediate use is paramount. If you have access to the pill right after unprotected sex, do not hesitate. Take it immediately. Another crucial aspect that all women should be keenly aware of is the potential for side effects following the ingestion of the morning-after pill. These effects can, at times, significantly impact your daily functioning and overall well-being. Some of the most commonly reported side effects include dizziness, nausea, vomiting. This is particularly important. If vomiting occurs within 2 hours of taking the pill, it's possible that the medication was not fully absorbed into your system. In such cases, it is crucial to contact a healthcare provider immediately, as you may need to take another dose or consider alternative emergency contraception options. These symptoms can sometimes feel uncannily similar to the effects of a severe hangover, leaving you feeling unwell and potentially making it challenging to concentrate, perform daily tasks, or maintain your usual level of productivity the following day. While these side effects are generally temporary and subside within a day or two, being prepared for them can help manage discomfort. Moreover, it's essential to recognize that taking the morning-after pill can indeed disrupt your regular menstrual cycle. Many women report experiencing changes to their period after taking emergency contraception, and this can sometimes be a source of anxiety if not anticipated. The pill's potent hormonal content acts as a sudden, temporary surge of hormones in your system. This hormonal fluctuation can essentially reset your body's natural cycle. For example, if your typical menstrual period usually commences around the 1st to the 5th of any given month, taking the morning-after pill might cause your subsequent period to arrive either earlier or later than expected. You might find your period arriving 5 to 7 days after taking the pill, or it could even cause a significant shift, delaying your entire monthly pattern to a new timeline, perhaps causing your next period to start around the 21st or 22nd of that same month, as if you've pressed a reset button on your cycle. This shift, while usually temporary, can undoubtedly be confusing, inconvenient, or even stressful if you're unprepared for it. It's a direct consequence of the pill's hormonal influence on your body. Because of this, it is highly advisable to monitor your menstrual cycle closely after taking emergency contraception. If your period is more than a week late from its expected new arrival date, or if you have any concerns, it is absolutely crucial to speak with a healthcare provider immediately. A significantly delayed or missed period after taking the morning after pill could indeed be a sign of pregnancy, warranting prompt medical evaluation. One very important misconception that needs to be unequivocally clarified is that the morning after pill cannot stop or reverse an existing fertilization. If a sperm has already fertilized an egg and that fertilized egg has begun its journey or even implanted in the uterus, taking the morning after pill will not stop a pregnancy from continuing. It is not an abortion pill and should never be mistaken for one. Its action is purely preventative of pregnancy, not abortive of an established one. Given this fundamental distinction, it is incumbent upon all women to take personal responsibility for using this medication appropriately and with a clear understanding of its significant limitations. Healthcare professionals, including myself, do not recommend using the morning after pill as a regular, primary form of birth control. If your goal is to prevent pregnancy over a sustained period, whether it be for 6 months, a year, or longer, it is absolutely paramount that you engage in a detailed discussion with a qualified healthcare provider. They can offer personalized advice and guidance on more reliable, sustainable, and suitable long-term contraception options tailored to your individual medical history, lifestyle, and preferences. Furthermore, if hormonal contraception is not desired and your partner is in agreement, barrier methods such as condoms remain an excellent and accessible alternative. Condoms not only play a crucial role in preventing pregnancy, but also offer vital protection against sexually transmitted infections, STIs, a benefit that hormonal birth control methods do not provide. It is absolutely essential that partners engage in open, honest, and informed communication regarding their contraceptive choices. Ideally, these discussions should be guided by the expert advice of a qualified healthcare provider who can help assess all available options and determine the best fit for both individuals. Finally, and this cannot be stressed enough, the morning after pill is designed and intended for occasional emergency use only. It is not meant to be a routine method of contraception used frequently, such as after every instance of unprotected sex or on a weekly or monthly basis. Frequent or indiscriminate use can lead to significant hormonal imbalances, persistent menstrual irregularities, and a heightened risk of experiencing more pronounced side effects. Responsible use of emergency contraception, coupled with proactive engagement with professional medical advice for long-term family planning, is the cornerstone of maintaining both reproductive health and crucial peace of mind. Your health journey is a partnership, and informed decisions are your most powerful tool. What other aspects of healthcare or daily life in the USA would you like us to explore in our next discussion? Share your thoughts in the comments below. Thank you for watching, and see you in the next video.